now in the Doc Zone. Nowadays, we spend more time than ever on gadgets, from computers to laptops to iPads. But that can turn into a real pain if you're not careful. Doctors Mark Dinowitz and Mark Lieber from OrthoArizona join us to explain. Thanks, doctors, for being with me here today. So let's talk about the most common injuries that you see with patients when it comes to hands and wrists.
One of the most common injuries we see with patients coming in with hand and wrist traumatic injuries is a fall onto their hand where they sustain a fracture of the wrist. It's actually the bone that connects the wrist to the hand. It's called the radius, and it's a very common injury. Most of the time, there'll be a lot of pain associated with it, some swelling, maybe a little deformity. We'll get x-rays, and depending on how the x-rays look, most of the time it's just casting, but occasionally surgery.
Dr. Dinowitz, there's a couple other issues.
Yeah, we see a lot of tendinitis, a lot of overuse injuries. We see a special kind of tendinitis called trigger finger, where their fingers will snap specifically in the morning, is most common. And then arthritis. There's arthritis to the knee and the hip and the shoulder, but people don't know the hand arthritis is extremely common. In fact, the base of the thumb arthritis is probably the most arthritic joint in the body. And there are many treatments for it. We have splinting, we have cortisone injections, and finally it could come to surgery, but there's a lot you can do non-operatively for arthritis of the hand.
Are people shocked when you say thumb arthritis, when you diagnose them with that?
I think so, but usually they're coming in with years of pain and they're like, yeah, I thought it could be that.
Okay, so doctors, the other big issue that we hear about is carpal tunnel. So we have a Facebook viewer question of the week, and so this is from Erin, and she said she works at a job where she types all day, and she's starting to get some pain in her wrist. And so is that maybe the signs of carpal tunnel, and should she be worried about that?
Well, let's first describe what carpal tunnel is. Carpal tunnel is a compression of one of the nerves that goes from your forearm into your hand, and there's a ligament that lives right across the base of the palm here, and it can get thickened, and the contents of the carpal tunnel, the other structures within the carpal tunnel can get thickened, and the nerve, which is the weakest, gets pinched, and that causes pain, numbness, tingling, and sometimes pain at night that actually wakes patients at night. As far as specifically whether typing can cause carpal tunnel, that is somewhat of a misnomer because a lot of patients will say, I can't have carpal tunnel, I don't type, and that's not true. Many things cause carpal tunnel, and typing has been proven not to cause carpal tunnel other than to be associated with carpal tunnel.
And some of those other causes we talked about for carpal tunnel, Dr. Dinowitz, I saw something from obesity and then smoking.
Yeah, smoking definitely is associated, but more highly associated is diabetes. The diabetes is probably the #1 association, and hypothyroidism. People with low thyroid are very susceptible to carpal tunnels.
And why is that?
It really has to do with the thickening of the ligament that Dr. Lieber was talking about, and the nerve. It's like someone stepping on the garden hose and these 3 fingers aren't getting water. So they'll wake up at night shaking their hands out, blow drying their hair, driving to work, reading at night. They'll just say, I have to keep shaking my hands out, my fingers go to sleep.
So with carpal tunnel, there's a treatment and procedure that you guys use, and what is that called?
Well, we'd use, for the surgery, we use the mini open. There are a subset of patients that can be treated with non-operative, but unfortunately when the nerve is getting pinched and you're having severe symptoms, really operative intervention becomes the mainstay. And the treatment we use is a mini open. It's a smaller incision in the base of the palm, right about here. The old incision used to be fairly substantial, and through that incision we visualize the ligament, cut the ligament, and release the pressure that's on the nerve.
So Dr. Dinowitz, recovery is a big thing. People want to get back to their daily activities. So what would happen if they had this procedure? How fast could they get back?
Yeah, it's actually a pretty quick recovery compared to some of our other bigger procedures. The carpal tunnel release can be done under local anesthesia only, so the patient does not have to fast overnight, no anesthesiologist, no EKG or chest x-ray, no preoperative planning. So they can come in, eat a full meal, do the surgery under local, and many patients will drive themselves home. When they're done, we usually put a little protection over the wound, but the fingers are left free, so the next day they can drive, type, and usually shower within 4 to 5 days.
So I could assume you guys did a lot of thank yous when you help your patients that have these issues.
Yes.
Yeah, I think so. And carpal tunnel is probably my favorite operation because it is so easy, but it changes their life so quickly when they can't sleep for months at a time.
All right, well, thanks for the great information on hand and wrist issues. I'd like to thank doctors from OrthoArizona for being with us in the Doc Zone. Join us each week as we tackle new topics on joint health.